have um, a packed session. So I will hand things over to our speakers, starting with Jessica, which I will, you should be able to share your screen, Jess, and we'll be able to move forward.
Okay, I'm so sorry. So give me one moment. I just finished seeing patients for the morning. So of course, no matter how hard you plan the day that you are gonna give a talk, it's the day that there's always an emergency in the clinic. So give me 1 second and I'll pull up my screen, and I hope everyone is having a really excellent morning and that the conference has gone really well. And a little bit about me while I'm doing this. So my name is Jessica Sherman, and I have been a nurse practitioner for 7 years, and I have been working in HIV for all of those 7 years. And it's really an honor to be here today and chat with everybody. And so basically what I'm gonna do is talk about, I'm gonna walk you through what it's like in a visit is really the plan. And so sort of what to expect. I'm gonna give you all of the sort of inside information on what to do and what's gonna happen in your visit. So let me share the screen here. Can everybody see the slides?
Yes, we can. Thank you.
Awesome. Perfect. All right. So basically what is going to happen during your medical visit. So just a quick overview. So the most important thing that I want anybody here today to take away from this is that it is vital that you feel comfortable talking to your provider. This is one of the most important relationships related to your health, is you and your provider. And if you are uncomfortable talking to them about how you're feeling physically, about what's going on in your life, about how your mental health is doing, you are not, there's things that might be missed, and this will impact your healthcare. So the number one thing, if you leave here with nothing else, that I really hope that everybody knows is that it's really important that you're comfortable talking to the person that's helping to keep you healthy and helping to take care of you. It's also 100% okay to ask questions. And I know that that can be a little intimidating. The exam room is not a friendly place. It's not warm, it's not welcoming. There's a power dynamic that I think we need to acknowledge between the provider and the patient, and it can be intimidating to ask questions. And just remember that it is your health and it is your body, and it is okay to ask questions. And I often tell people too, you know, we all have our phones with us because sometimes questions hit us at off times. And so I always just say, pull out your phone and write a little note in your memo section and to put your questions there. So that way you have them, because inevitably when you're in the exam room, you will forget. This happens even when I see my doctor. So I'm oftentimes like, oh, I had questions and I can't remember. So I want to just go over briefly like what it looks like to be in care. And so you're going to have that initial visit, and that initial visit is going to be fairly long. We're going to ask a lot of questions and do a lot of things. And then if we start medications, we typically follow up 1 month after starting medications, and we'll do lab work at that visit. And we want to make sure that the medications are both working and that both the medications and the virus are not causing harm to your body. And then you take your medications every day, and you'll follow up every 3 to 6 months and in between as needed. And so what I'm going to do now is sort of walk you through like what happens in a medical visit, because I think knowing this makes it less intimidating. And so every medical visit is structured really similarly. And so you'll, your provider will get what we call the history, they'll do the physical exam, they'll put all of that information together to make their assessment, and then you'll come up with a plan on how to move forward and what is best for you. So the history, and so especially at that first visit, we are going to ask you a lot of questions, and it's going to be very personal. And I think it's really important to note that if your provider is using a language that you're uncomfortable with or a term that you don't know, that it's okay to say, hey, I prefer this term, or I don't know what that means. And that's 100% okay. We're going to ask you questions. Some of them are going to be pretty basic, like what's your medical history? Does anyone in your family have cancer or heart disease? And then we're going to dive in to some of the harder questions. Like how are you doing since you found out that you are living with HIV? We're gonna ask you about sex. I really love Salt and Pepper. I wasn't sure if I was allowed to put their picture on here, so I put this instead. It was actually the first CD I ever owned. So anyway, and so we are gonna ask you about sex, and we're gonna ask how you feel about having sex since your diagnosis. We're gonna ask what the gender of your sexual partner is. We're gonna ask what parts of your body do you use when you have sex? And we're gonna talk to you about how to have a healthy and sex life that you want while living with HIV and what that looks like for you and your partners. We're gonna ask about your support system. We're gonna ask about housing. We're gonna ask about alcohol and drug use. And I can tell you that I don't ask about these things because I am here to judge you or to notify someone. I'm asking because these things play a really, really big role in your health, and they help me to know what other things are going on in your life that might be a barrier to getting medications or taking your medication every day. So I just want to make sure that you know, because it can be uncomfortable with this person that you just met, and there's a lot going on. And so just know that there are reasons that I'm asking, and it is not to judge you or to notify the authorities. It is really because these things do affect your health. So then we're going to do your physical exam, and we're going to look inside your mouth. We're going to feel your lymph nodes. We're going to listen to your heart. We're going to listen to your lungs, your stomach, your skin. And here we're really just looking for signs that the virus, signs of whether or not the virus has affected your body. And so HIV can affect it can affect every body system. And so we're looking for sores inside your mouth, or some people may have heard of thrush, which is just a big white coating that can happen on the sides of your mouth and on your tongue. We're going to feel the lymph nodes in your neck. We're going to make sure your liver is not enlarged. And we're just going to make sure that, that everything is okay. So then is the assessment. And that's when we take all of the information that we got from talking to you and from examining you, and we're going to put it all together. And a lot of times now you'll have access to your chart, especially if you sign up for my chart. You can actually see the note that I write, and there'll be an assessment part. And this is where I will talk about, we'll make a diagnosis, and this is the information that we'll use to come up with the plan. And then the plan is the last part. And the really big thing, and this is where we decide what we're doing. And if you're in your first appointment today with the medications that we have, a lot of times we're starting medications on the first visit if you're ready. And I think that if you're ready is really important. There will be blood draws, especially on the first visit. We will take a lot of blood. We're going to talk about vaccines. And vaccines are really important because even, so if you're on medication, even if your viral load is undetectable and your immune system's doing well, things like the flu and pneumonia and meningitis can still affect people living with HIV a lot harder than it might affect someone who is HIV negative. So we want to talk about making sure that you're vaccinated. And we're going to talk about what your follow-up visit schedule looks like. If you're more sick at that first visit, maybe we're seeing you sooner. And if you're feeling okay and things are going well, then it might be a little bit later. So this is my last slide, and then I'll turn it over. I'm sorry, I've been rambling for a bit. So things that I really want you to remember, and again, I cannot stress this enough, is that you are worthy of excellent healthcare, and you should be involved in your healthcare. It is your body. That is the expertise that you bring to the table. I know a lot about HIV, I know a lot about high blood pressure and keeping people healthy, and you are the expert in your body. It's okay to ask questions. If you start medication and it's not working for you, make sure that you talk to your provider about that. There's a lot of options. And I think sometimes it's really easy to think like, oh, this is my only option. And we stress so much, like you have to take the medicine every day and you shouldn't, we don't love to change medications, but there are options if it's not working for you. And the most important part is that your medicine works for you, because this is, you have to take this pill every day. And actually now there's injections, so stay tuned. And then if you're uncomfortable with your provider, it's okay to ask to see someone else. And I know that that can be awkward, and I know that maybe you feel bad or don't want to hurt the feelings of your provider, but again, it is your body and it is your health. And if you are not comfortable being honest and talking with your provider about all the things going on in your life, you really do need to see someone where you are. And it's your health and you should be involved in the plan. And again, so just making sure that you're asking questions and if something's not working for you, making sure that you tell your provider that, and you guys should work together to come up with something that does work for you. And that is all that I had for my piece of this. And I will turn it over to everybody else. Unless anybody has, I don't know if we're doing questions now or later or.
I don't see any questions that are popping in the chat right now for you, Jess. If anything does pop up, I will make sure that we address it at the end. But now we can turn things over to SJ.
Hi, everyone. Thank you for introducing me, Matthew, and just to tell you all a little bit about me. I am a medical social worker at Columbus Public Health, and I am wrapping up actually my 6th year doing HIV medical case management in a lot of different environments. And so I'm going to be talking about, I can share my screen here, what to do after your appointment. So can everyone see this?
Not yet.
Okay, we're gonna try.
Now we can.
Great, okay. So following your medical visit, whether you are returning to care after taking a break from HIV care, which unfortunately happens sometimes, or if you're just getting started because you're newly diagnosed, kind of what should you be thinking about and how can you advocate for yourself to kind of prevent some barriers from coming up and keeping you engaged in care. So first, we'll talk about some questions to maybe be asking yourself and to just be thinking about when you're leaving the doctor's office. So the first question would be, when do you need to come back to the doctor's office? Sometimes an appointment will be scheduled for you, and sometimes you'll need to schedule one when you're leaving the office, you know, when you're checking out or when you're passing reception, whatever. You just want to make sure that you know what the next appointment is going to be. And something that is going to be different depending on where you're going is lab work. So as Jessica said, especially at the first appointment, there's going to be a lot of lab work done. Not all clinics have their own labs, some do. And some providers will have you actually come in before your medical appointment so that you can get the lab results back in time to discuss them with your doctor. Sometimes your provider will say, you know, the most important thing is just that you get here. So don't worry about getting the labs done beforehand. We'll figure that out after you come in, but that's all going to depend on what's available to you and what you discuss with your provider. So, and then another thing would be, do you have other appointments coming up besides medical appointments? Are you going to be meeting with a case manager or a therapist? Do you need to be keeping in touch with your public health department because of a recent diagnosis? Or other, you know, data issues. So anybody else that you need to be keeping in touch with. And the next question would be, what medications were you prescribed? If you were prescribed something, did you get a list of what you're going to be taking and the directions for them? What pharmacy is going to be filling them? Do you need to pick them up at that pharmacy, or are they going to be sent to your home? And then we'll get more in depth with this part, but who is paying for your medications? So we don't want you to be surprised when you go pick up your medications, or if you get a bill from a mail order pharmacy. You know, it's good to have an idea of who's actually going to be covering it, whether that's your primary insurance or some combination of assistance programs or something like that. Similarly, you definitely want to know who's paying for your doctor and lab visits. Medical care and medications, unfortunately, as we know in this country, are very expensive. So if you have insurance, you'll want to know, do you have a copay to expect every time you come in? Do you need help with the cost of care, with the cost of the copay, things like that. And again, we'll talk more about the resources that are available, but that's definitely a question that you'll want to have in your mind. And then of course, like Jessica said, you want to know, you want to feel confident that you understood what was discussed in your appointment. And these appointments are kind of like being bombarded with a lot of information sometimes. You might be feeling inundated with things to remember and questions that you have. But if there are, things that you want to ask, brings us to our next question. How can you reach your care team to ask those questions? Whether that's asking your provider directly or a nurse on their team or a medical assistant or just the front desk. Do you know who to contact and for what issue? If you have an emergency, are you going to call 911 or is there a different route that you need to take first? So those are things that you can discuss with your provider and your care team too. Sometimes you'll be asked to create a MyChart account, which can be a really great tool for keeping in touch for things that are less urgent related to your care, questions that you have, things like that. Okay, and so now we're going to get more specific. I would say generally what we've talked about so far between Jessica and myself has been kind of broad health literacy information that probably can apply to more or less everyone. So now we're going to get more specific about things that are available to people with HIV. And then, and some of these are available to the public also, but the first one that we'll talk about is Ryan White Assistance. And this is a program that covers doctor visits, lab visits, dental, and behavioral health. The way that you access it is different from state to state, but there are eligibility requirements. Some things to know about Ryan White are that typically you can only use this assistance at certain network providers. So going to the emergency room is probably not going to be covered by Ryan White. Things like that. And also something of note is that to qualify, you do have to demonstrate that you have pursued at least primary insurance before you apply for Ryan White. That kind of seems burdensome to some folks and you wonder, why can't I just get this assistance paying for my care? Why do I need to apply for insurance first? And if you already have insurance, then this wouldn't really be an issue for you. But the main thing is Ryan White is not going to cover everything. And it benefits everyone to have some kind of primary insurance coverage. We want to minimize the risk of you having a financial debt or a medical debt of any kind, or being, having some kind of emergency because of the cost of your care. So if you're not eligible for primary insurance because of your immigration status or something like that, there are workarounds, but in general, that is a requirement. So the next thing is patient assistance programs or sliding scale fees. And these vary just by office to office. Some medical centers offer programs like this. They're usually dependent on your income. So what you pay for your appointment or your care might be different than someone else just based on what you are able to pay. So you can access this just by asking at your provider's office what's available. Also, if you receive a bill in the mail for your care, you can look and see if there is a phone number for patient financial assistance or the billing office. They might be able to tell you what's available to help with that. Typically, if you're enrolled in a program like that, it needs to be renewed annually or at least periodically. So you'll want to be aware of how long that assistance is lasting. And keep in mind that this is not something that's offered by all providers, but some do. So, it never hurts to ask. ADAP stands for the AIDS Drug Assistance Program. And this is a prescription coverage program, which is really closely tied with the Ryan White program. It covers prescription costs as well as some health insurance premiums. So the monthly cost of insurance can sometimes be covered by ADAP. And to keep in mind that if you are using ADAP, that is a requirement. And then I wanted to mention Medicaid also. This is a primary insurance option for low-income individuals and families. So this is not specific to those who are HIV positive, obviously, but it is important to be aware of. It is available through local job and family services offices, and sometimes at your hospital or medical center, if there's a patient financial counselor, they can help you with this as well. There are eligibility requirements for citizenships and assistance forms that I group together as pharmacy assistants. So different pharmacies can offer different things, different medications come with different programs. And so these are just different things that can lower or cover the cost of your prescriptions. And really the only way that you can access this is to ask the staff at your pharmacy what's available to you. So it might be something from the manufacturer of your medication. It might be a copay card if you have primary insurance. So, you know, this could be a variety of things, but I wanted to mention this because a lot of times when someone is newly diagnosed or they're getting back onto medications after a break, they'll be enrolled in one of these programs, like a patient assistance program, and they'll feel like, okay, my medications are covered, which they may be for a time, but you definitely would want to know how long is that assistance going to last. Most of them are not permanent, and some of them can only be used one time, you know, in your lifetime. So be aware of how long that assistance is going to last, and then how you're going to access your medications when it ends. So I did just want to mention that because it's something that we see often. And now that we have gotten more specific with resources for people with HIV, we're actually going to talk specifically about what's available in Ohio and how to access it. So in Ohio, you can actually apply for ADAP prescription coverage by yourself. You can only apply for the prescription coverage, not the premium assistance, and not for Ryan White general assistance. So this is actually like a paper form that you would print out and send to the Ohio Department of Health to request help with your prescription costs. To access full Ryan White coverage, in addition to ADAP if you need it, Ohio residents can enroll in medical case management. And you may have heard of medical case management. You may be aware that medical case managers exist and wondering what they do, and it's a lot. So I just wanted to make a couple points about things that are offered through medical case management under the Ryan White program. So one of them is obviously accessing Ryan White, ADAP, and any other programs that you are needing. And then also you'll have a supportive person working with you to help educate you, advocate for you, and provide you resources to keep you healthy and try to prevent any barriers to care from becoming a consistent issue. So we're kind of just here to support you in any way that we are able to so that you stay healthy. How long should I expect it to take? This is a question that we get a lot from medical providers and from new clients. So I just wanted to talk about the process for accessing it. The first step is going to be to complete an intake with the agency who provides medical case management. Sometimes that's the same as your medical provider. Sometimes it's a partner agency, just varies depending on where you live and what's available. When you complete an intake, you will be given a time frame of when you can expect to be contacted by the case manager who is assigned to you. So that person is kind of going to be your designated person, and they are going to need to meet with you or complete a phone call and just gather information, get to know you, and collect any required documents for the programs. After they have everything they need, they're going to enroll you in programs that are appropriate for you, and then set some goals with you for the future and talk about how you can achieve those goals together. What is required for Ryan White and ADAP? So you will need to provide documentation of your income. So like I said, there are some eligibility requirements here. So income from the last 30 days for you and your spouse if you have one. You'll have to prove that you're an Ohio resident, usually just with an ID or something like that. And then insurance card or proof of application for primary insurance. So remember, we were talking about the requirement to pursue insurance. You might have to apply for Medicaid and provide either a receipt or a copy of your Medicaid application, or otherwise, something from your job that says that you're going to have open enrollment in a few months and you'll be eligible for insurance then. You'll also need to provide proof of your HIV diagnosis, which usually your case manager will be able to help you get either from your doctor or from the state system. And then ongoing, you'll be meeting with your case manager at least every 6 months. So this will help you to prevent coverage lapse because ADAP and Ryan White coverage lasts for 6 months at a time. And also it's just going to help you keep in touch with them so that they know what's going on with you. And, we can't help if we don't know how. So it's good to have an open relationship with your whole care team, but including your case manager, as far as just letting them know what's going on with you and what kind of help you're needing. If you have concerns that you're not going to be able to, afford your care or get to your appointments, those kinds of things, we don't want that to stop you from staying engaged. So those are the kinds of things that you'll be talking about. And so that is all I have. And I'm trying to, there we go. And so now I think we're actually going to hear from Devin and Gregory. If there aren't any questions that have come up yet. That was a ton of information, so.
There was only one question it looks like that came through, and that was about the income cap for the Ryan White program, which I responded to saying 500% of the federal poverty level for the household income. So for that purpose, I'm not sure what the new federal poverty level is, but looking at 2020, if someone makes around $62,000 a year as a single person, then that would be the income threshold. Is that correct?
Yeah, it's around there.
Yeah, and then if you have a spouse or a second person in your family living with you, then that income requirement goes up from there. So you can find that online if you Google federal poverty level and then identify the household size that you have, and that would give you that information. So that can be all found online as well. But thank you, SJ, really appreciate it. We can turn it over to Devin.
Thank you, Maddie. Thank you, SJ, and thank you, Jessica, for your presentation. My name is Devin Quinn. I use he, him, his pronouns. I have been living with HIV for 9 years. It'll be 10 years in February of next year. And I have been living successfully and alongside HIV, I guess you could say, all that time. And my process was kind of mirrored a lot of what Jess and SJ were talking about in terms of walking through the systems of care. So I was 22 at the time of my diagnosis. I got tested at a routine testing, kind of community-based testing center. At the time, I was testing every 3 to 6 months. I was enrolled into care very quickly once I was connected with a healthcare agency after I tested positive. And from there, they walked me through the process and told me, this is how this is going to work. This is what Ryan White is. This is what it does. This is what it will pay for. And as a newly diagnosed patient, it's overwhelming. It can be so much thrown at you. And as someone at the time who had very little experience dealing with medical providers, I'd really never seen a doctor beyond, my childhood pediatrician for, just routine things. I'd never even broken a bone in my life, let alone I'd never been hospitalized. So going from this negative space of not dealing with or not having to deal with the medical industry to this space of this is your doctor now. These are the nurses. This is the clinic you go to. These are the complex systems of bureaucracy that you now have to navigate and understand, or how to make sure you fill out this paperwork so that your medication is paid for, so that your doctor's visits are covered, and so that you don't incur a bill if you can't afford pay a bill. It can be really overwhelming. I feel very fortunate that I had a support system in place to help me at that point in my life, whereas I know folks who didn't have that same support system and really struggled. I was enrolled in care, and thankfully, very quickly, I became undetectable by starting my medication and adhering to it. I consider myself very fortunate. I think that's a benefit of my privilege, and I think that I'm aware of that. But I know a lot of folks who weren't, and so it can be daunting just to take that first pill, just to go to that first visit, just to experience that first moment where you're not sure how things are supposed to work. And what I tell people now is one of a previous job that I had not long after I was diagnosed was that I ended up starting to work in the field of HIV and HIV care. And the first job that I had was as a peer navigator. So it was my job to meet with newly diagnosed folks or folks who were returning to care or entering care where I worked, and walk them through the process of what it's like to be HIV positive and receiving treatment. So they understood that it wasn't just a doctor talking to you. It wasn't just a nurse. It wasn't just this intimidating kind of scary environment that you weren't familiar with. It was something that there was somebody along that journey who could relate to your experiences even just a little bit and provide you some firsthand knowledge about what that was going to be like. I wish there had been someone like that along for myself, because I think I would have benefited from that greatly. Because you really don't know what questions you're going to need to ask. You don't really know what questions you'll need to navigate. And as wonderful as the providers that I saw were and are, that's not always everybody's experience. That's not everybody's journey. Sometimes you go through a few care providers. Sometimes you live in a rural or inaccessible area that doesn't have a provider who even knows about HIV. And so the nearest clinic that can see you might be 2 hours away. And then you have to find transportation and figure all that. It can be very daunting. And so while we focus in a lot on making sure that people are adherent, I think we also have to focus really carefully on meeting people where they are and ensuring their basic needs are met. Because if someone is not sure where they're sleeping each night, the last thing they're probably going to worry about is taking their medication each day. And so we have to look at the whole person and understand that that can be a challenge for them. I'm 9 years later, I am doing quite well. My, viral load has continued to stay undetectable, and my CD4 count has continued to stay nice and high, where I'd like it to stay. It's funny, I occasionally get opportunities to speak to younger people, I should say, about HIV and its effects on life. I recently spoke at a high school health class, and one of my coworkers who was there with me was out and about in town recently, and she ran into one of the high schoolers who was there. And the high schooler said, "I just loved your presentation. I learned so much." And that man, referring to me, he just seems so happy to be living with HIV, which is, it's a funny thing to hear that, right? Like, it's like, that's not really a way I ever thought about it being phrased, but I'll take it. I'm doing happy, I'm doing healthy. And I think that's a testament to the wonderful people who work in the field, who care so much about the folks that they serve, and also being able to walk along that journey with them and having that wherewithal. It's not an easy thing, but it's something that can, affect your life very difficult in a very difficult way. But as I've said to many people, that HIV is no longer a death sentence. but it's still something that you're going to have. It's a chronic condition that you're going to have to work through and manage on a daily basis. But when folks are able to prioritize it in a way that's helpful for them, I think that makes all the difference. So I think with that, I'm going to turn it over to Greg, unless, Maddie, there are any questions.
There are not currently any questions in the chat, but I'm sure there'll be some coming through, and then I have some at the end. So.
Sure.
Okay, thank you for that, Devin. I appreciate you sharing your story with us. So I'm Greg Price. I use he, him, his pronouns. I'm currently a health navigation coordinator with Equitas Health, where we help people access PAPI and PrEP. So my story is a little similar to Devin's. However, I was diagnosed with HIV at the age of 16 and basically had to navigate the system myself. I did have a lot of help from care providers that I actually provided services with me over at Nationwide Children's Hospital. So I've actually been living with HIV for the last 16 years. I'll be 33 at the end of, or at the beginning of August. So yeah, it's been now 16 years. So a little bit about my story. I was diagnosed when I was 16 and had to figure it out on my own. So being at that age, I really didn't know much about HIV. It wasn't something that was discussed in my household. And even amongst my peers growing up, we didn't talk about it. So we didn't know what it was. So when I received my diagnosis, I had to tell my mom. And from there, it was just, you know, a game changer for me. So I tell people a lot of the time, actually, when I'm speaking to the public, that HIV actually saved my life. And it's hard to understand that if you haven't gone through it, but growing up where I grew up, I could be easily not here today. And when I say that HIV saved my life, it was the life event that made everything surreal to me. So it was the thing that made me appreciate life more and take a better look of what my outcomes should be and what I wanted out of life. So with that being said, being HIV positive made my life turn around for the better. And I say that because I was able to educate myself in a manner that provided me opportunities to work for an organization that provides health services to people who are HIV positive as well as people who are HIV negative. I was able to securely put myself through schooling to be able to make like a difference in my community. And being that I was diagnosed at the age of 16, I always wanted to, you know, have in the back of my mind that I needed to be that person for that 16-year-old that didn't have that type of experience that I had. So I needed to be that advocate for that boy that was 16 and getting that diagnosis. So I always, when I go into any position that I have that understanding. You need to be the advocate for that person who doesn't have an advocate or who can't navigate through these healthcare systems that, you know, both Jess and SJ have mentioned. You need to be that person to guide that younger generation. And being that I've secured a position here at Equitas Health, I think that we do that pretty well. Like Devin had mentioned, we talk to high school students, we talk to different colleges and universities, people in our neighborhoods. And I think that's where we do the most of our good deeds, I guess you can say, is just giving back that education to the communities who otherwise wouldn't talk about it or do not know about it. And I think that's where we do the most of our good work, is just giving back to those communities. I will say that that anybody that's out there that need that type of a guidance or wish that someone would come into their communities and ask that they need that education, reach out to us. I know myself, the team that I manage, And anybody that works in our prevention department here at Equitas Health is willing to just go out there and get the work done. So I'm asking that if you need that assistance, please ask us. It's not a problem for us to, be there and educate those in the community that need to be educated. And I think that pretty much is, the sum for me. Maddie, did they have any questions for us?
Yeah, there's no specific questions in the chat right now, but we can feel free, folks, to put questions in the chat as we go. I did want to ask, Greg, you work, as you mentioned, with health navigation. And that can be really challenging for folks just navigating the systems, as SJ was talking about all of these levels of services. And Greg, you work specifically with a program that focuses on people who are not living with HIV, but accessing PrEP care, PrEP services. Can you speak to some of the challenges and barriers that you and your team find to be pretty consistent with accessing services in general?
Yes, I think one of the major barriers is that people don't realize that there's help. There are programs literally out here that will give you the necessary tools that you need to actually receive the healthcare that you choose to have. So with that being said, I don't think that there is enough education in the community, which is one of the barriers that many of us face amongst, all of the departments here at Equitas Health, is that there are services out there. You just have to ask. And even if you don't, know how to research it, if you can find that one point person who can point you in the right direction, you can get almost anything that you need for your healthcare services here at Equitas Health and any other agencies that we collaborate with as well. You just have to ask and not be shy about the things that you need for your healthcare. Another barrier that I would say, which comes, I think, second to that, would be providers actually prescribing PrEP. So, we do a pretty good job here at Equitas Health, at Columbus Public Health, because we know the importance of it. Whereas, you have other primary care providers in the actual communities that don't see the importance of it. And that's troubling to me. And I see Jess over there saying, yes, yes, yes. That's troubling to me, because whether your primary care provider thinks that it's a necessity or not, you have to understand, if you're sexually active and you have a partner that's either HIV positive and you want to be safe and remain safe, these are necessary things that you need to make a healthier relationship, choose smart, or having smart decisions when actively engaging in your healthcare with a person that's HIV positive or not. Because, sometimes in this field, there are people who are, unsure of their status, and, that's okay. They don't have the necessary tools to actually get their status. And it happens all the time. And there's no fault to them. They just have to be educated on how to get and be vigilant of the things that they're doing. So those, to me, are the two major barriers that I see people have that they don't realize they don't necessarily need to have. Because with that being said, we can break down each of those barriers. However, you just have to ask.
Thank you for sharing that. There is another question that came through. And this is specific to Devin and Greg. But I would also like to pose this question in a different way to SJ and Jess. So for Devin and Greg, did you experience any stigma or discrimination after testing positive, and how did you deal with that?
Yes. Short answer, yes. Absolutely. I think there were quite a few experiences. Whether it was I was looking for employment at the time, and I was not aware that I didn't have to. I did not have to disclose that to an employer, and when I did, they did not handle that well. To dating, I had some folks who just, once I told them my status, they, in one way or another, just either departed my company or said, you know, that just didn't interest them. They weren't interested in being with someone who was HIV positive. I think probably the most recent experience, it's not even that recent, it was a few years ago. When I lived somewhere else, I was getting an apartment with a roommate, and I was working at Nationwide Children's, which is very close to where I was living. And we were signing the lease with the landlord, and the landlord asked what we did. And my roommate at the time said, oh, I work for the state, I work in benefits. And I said, oh, I work at Nationwide Children's. And he said, oh, are you a doctor? I said, no, I work in the HIV clinic. And he took 2 very large steps back from me. And I took 2 very large steps forward. Because I just was not feeling interested in playing that game. I said, there's nothing to worry about. But I have, you know, it's taken a while for me to be able to overcome those barriers personally. You know, I went from feeling very dejected and sad about when people would express those things to me to now feeling combative is not the right word, but triumphant, and being willing to kind of like talk through those things, or just not even entertain it if it's not something I want to hold space for. So I've definitely experienced that.
Perfect. So for me, I haven't experienced like the stigma to my face. I'm not blind to the fact that it's there, but I haven't gone through where I've, you know, presented my status to somebody, be it a job or a friend or anywhere in the community that I experienced a negative feedback from me saying that I was, you know, HIV positive. With that being said, like I said, I have seen it, but just not experienced it myself.
Thank you for sharing that, Greg and Devin. And I kind of want to transpose this question for Jess and SJ in a different way. So working in the positions that you have you witnessed any sort of discrimination happening to your patients or your clients, or anything that's been shared with you that was, you know, concerning?
I don't know. SJ, do you want to go first, or
No, go ahead, please.
Okay. I'm so glad that someone asked this question, and I will rein it in because I could literally talk about HIV stigma all day. So I see HIV stigma, and I see HIV stigma manifest in different ways. And I have had patients have experiences like Greg, where they have supportive people. And I've had patients have horrible experiences where family members are afraid to eat after them, where they're afraid to use the same bathroom, where people are told that they can't, like maybe they shouldn't be able to take care of their kids, which I'm going to be very clear that having HIV has nothing to do with whether or not you're a good parent. Sorry, I get a little enraged when I hear these things, and it's, and I've had patients have friends and family members like expose their status on social media. In Ohio, HIV is criminalized, which is a whole nother, I'm gonna try really hard not to get on my soapbox. And I think for me as a provider, all of these things are hard to watch my patients go through. And I think maybe I will say one of the hardest things, I think even with all of that, is that I see a lot of my patients internalize the stigma and apply it to themselves. And so many people feel dirty or like they deserve what they got. And I've had people sit in front of me and tell me this, and like, that's not true at all. And then when you internalize those feelings, it can become very difficult to take your medications, because then that pill every single day is a reminder that this is what's happening, and that can be really hard to accept, and that is heartbreaking when I see that. And so those are how I have seen stigma manifest. And, you know, just like Devin, I was getting my wedding dress tailored, and the woman asked me like what I do, and I was like, oh, I'm a nurse practitioner, I specialize in HIV care. And she was like, oh, like, is that safe? And I was like, I don't know, is it safe for you So it's there. And the other thing I think, and then I'll turn it over to SJ, you know, there's no reason that we should have new HIV infections today. If you are undetectable and living with HIV, you cannot give the virus to your sexual partners. And we have a pill that you can take every day to prevent HIV. The medicine, the science has gotten us there. We, the medical system and providers, haven't used those tools. And to me, that is the ultimate sign that stigma still exists, because these systems are hard to navigate. Providers don't want to talk about PrEP. Providers have preconceptions like, oh, you're not at risk. Well, what does that mean? How do you know I'm not at risk? And so, like, to me, that's the ultimate sign that stigma is still a really big problem. Now I will be quiet.
I think the anecdotes that both Devin and Jess gave are so important. The first thing that I want to say is one of the most overwhelming things that a person experiences with an HIV diagnosis is deciding who needs to know about it and who doesn't. And so I would definitely encourage you to utilize your care team for that reason. We know about your status, so like kind of the ice is already broken there. And we want to help, you know, we want to help you talk through, you know, maybe there are people in your life who do not need to know. It doesn't benefit them and it doesn't benefit you. And you don't have any implication to share your status with those people. So, you know, utilize the supports that you kind of by default have, if you can, and if you're comfortable, to figure out whether it's necessary or, you know, whether that's your privacy and kind of a boundary that you can have. And then another thing that I do want to mention, and this completely comes back to what Jess said about you deserving the best possible care. You do, and unfortunately, doctors and, you know, providers are not perfect, case managers are not perfect. And I have seen bias come out in appointments before. I've attended a lot of medical appointments with folks where I was not comfortable with the way that a person was being spoken to by a provider or treated based on their status or any other biases that provider might have had. And that just comes back to, you have the ability to say, like, I don't want to see this person. I don't want to work with this person. This is not the best possible relationship for me to have with somebody who is an important part of my life. So, you know, utilize the supports you have. And if the supports you have are not cutting it, I hope that you feel a sense of agency and can advocate for something better for yourself.
Thank you, SJ.
Really quickly, I'm so sorry. Can I add one thing?
Oh, you can absolutely add as much as you want.
In terms of telling people, and I would be really curious what Greg and Devin's opinion on this are. I feel like I do try to tell my patients, have one person in your life, if you can, that knows. Because I don't know what it's like to live with HIV, but I can gather that it is sometimes really challenging and you're gonna have bad days. And I think if you just have one person in your life that can support you on those bad days, that makes a really big difference. And so I would just be curious sort of what Greg and Devin would say about that. And yeah, that's it.
Yeah. I would actually, I said the same thing to all the folks that I met when I was a peer navigator. You know, I said one of the first questions I said was, are you talking to anybody about this? Like, do you have anybody in your life who can, you know, even if it doesn't have to be a family member, it can be your best friend who can come to your appointments if you need that, you can just vent to. You know, I served some of that role, but I was not in their, you know, friend group. I was not their friend. I was a care provider. I couldn't, you know, bridge that personal gap. And so there was only so much I could do. And so I would always ask them, do you have somebody? It's really important that you talk to somebody. And I'd say most of the time folks did, but there were occasionally some folks who didn't. And that, you know, my role at the time was the only person they could talk to. And they didn't know, you know, maybe they just didn't have the ability to go and seek somebody else to talk to, or they were scared. And so some strategies that I created for folks were say, you know, they were thinking about telling someone. They thought they couldn't tell if this person was going to be receptive or not. So I said, you know, if you feel comfortable, you know, maybe go to them and say, I have a friend who's just told me they're HIV positive and I don't know how to handle it. Do you know anybody who's HIV positive? How would you handle that? And pose the hypothetical to this person. If they react in a positive way, then that lets you know that this person is trustworthy and safe, and then you can disclose to them. And if they react in a negative way, then you kind of have your answer. So or maybe you just work on them with education after that point. So it just kind of depends.
I think for me, and sorry, it's kind of, I think that helped, Devin. Thank you. I think for me, my advice would be to find that person that, without doubt, you can trust. For me, it was my mom. And then once I told my mom, I didn't care who else knew at that point, because the love and the understanding that I got from her in that moment of me telling her that I was positive was all that I needed to know that I'll be all right. Because without a doubt, I knew that my mother had my back and that it was just me and her against the world. So find that person that you're able to have that relationship with and go for it. I think in my heart of hearts that if I believed that she wouldn't support me, I probably wouldn't have told her, but I knew that she would have. So my advice to anybody that's newly positive is to find that person. And if you have to, scope people out to do so, do it, and be very vigilant of this person may not, respond to it. So be careful. And I guess just be you when doing it, because at the end of the day, you only have yourself to look out for. Be sure that you're ready to do that is another thing. You don't have to do anything until you're ready. No one should ever make you feel forced to disclose your status to them. You'll know when you're ready. You'll know what time and what place and where it needs to happen. You'll know. If you don't feel safe doing it, then don't do it. Don't do it. Again, you don't owe anybody anything as it pertains to your healthcare and you disclosing of your status. That could be a conversation between you and whoever it is that you reach out to. Just make sure that you're understanding that you owe it to yourself and not anybody else.
Thank you. Thank you all for answering those questions. And thank you, Jess, for posing that question. I love the conversation that's happening. And I did want to add, because this is, I think, really important, specifically in Ohio, but other places around the country may have similar events. But Devin, I'm gonna put you on the spot. So Devin manages a team of folks who put together a leadership summit each year. This summit is inclusive of people living with HIV and people who are not living with HIV, or people who don't know their status. And it's for youth. It's for folks to help them, or I'll hand over to Devin, because Devin, you can explain it and you can, highlight how amazing this is an opportunity.
Sure. Thank you, Maddie. I appreciate the shout out. So I manage a program at Equitas Health. And one of the programs that we oversee is the Ohio Youth Leadership Summit. Some folks may have heard of it before, as it used to be known as the Positive Youth Leadership Summit. That had existed for about 13 years. And so it's changed a little bit as folks can probably tell. It's now accepting of not only those who are HIV positive, but those who would maybe be considered at risk for HIV, or those who are, don't know their status. And so it's for ages 18 to 29. Previously, it had been an in-person event, but because of COVID, we changed it to a virtual event. It will go back to being in person next year. But this year, it's a webinar series that will take place beginning in August on the third Saturday of each month for 3.5 hours. It's a lot. It's a bit of a commitment, but we do pay participants for attending. So it is a leadership summit in which folks will learn job readiness skills. They will learn harm reduction skills. They will learn HIV 101 skills. They will learn things about PrEP and PEP. They will learn things about healthy relationships. criminal justice and abolition, all sorts of things that will be helpful for them in the future. We'll be having some folks come in and speak from outside of the agency and in the community to talk about specific items. And it's a really great tool for just learning skills that will benefit you in the long run. And it's a really great tool for empowerment. I myself, when I was newly diagnosed, was handed a flyer about this summit. And that was a weekend long at a hotel that was for just HIV positive young folks. And I was like, I don't want to go to that. I don't know anything about this. And I ended up going, and it turned into an amazing experience. I ended up going a few years. And then at one, I was the first Youth Summit participant to actually host my own workshop there. And now, many years later, I run that summit. And so it's a really great privilege for me to be able to be a part of this. And I will have, I guess, Maddie, I'll give you some stuff so you can send out to folks for a link. But if folks are curious, they can visit ohioyls.org, and they can take a look at our website and apply if folks are within the ages of 18 to 29. And if you have any other questions, the website will answer those, or you can get in contact with us. But it's a really wonderful opportunity, and we're accepting applications. We just extended our deadline until July 15th. So we're still looking for some folks, and we are excited to have it this year.
Thank you, Devin. And yes, I put in the chat for this session the link to the ohiv.org/OhioYLS website, and that way people can check it out and refer folks. So thank you for highlighting that. I don't see any more questions here in the chat, but is there any final words you all would like to share, or one thing that you think is, above all, the most important to think about when working with folks who are newly diagnosed, or working with folks who are trying to re-engage in care? Because that's a huge piece as well that can be just as scary, if not scarier, than a new diagnosis.
We can kick off here. I can, like Jess, talk ad nauseum about these things. I get very impassioned as well. But one thing is that if you know someone who just needs to get a test or is struggling and doesn't know who to go to, shameless self-promotion here, ohiv.org is a resource that folks can access. They can look for testing in their area. They can request a free test kit, and we will mail one to them if they live in the state of Ohio. I know there are folks out on attending this conference who don't live in Ohio, but if there are folks who live in Ohio, they can go to our website. They can request condoms. They can get connected to PrEP Navigator, maybe someone on Greg's team, or even somewhere else in the state of Ohio. We have a new form that will re-engage folks in care called Care Connect. So if they just fill out some information, it'll send it to a provider in their region, and it'll connect them with care. So, and I say all of that not only to shamelessly self-promote, but I say that because there are resources, as Greg mentioned, that it's hard sometimes. It's sometimes dizzying to know where to go, but this is a one-stop resource that folks can access that's really easy for them. But I'd say overall, if you're working with someone or know someone who might be dealing with an HIV diagnosis, treat them how you would want to be treated. Be kind. Be a good listener. Sometimes I'm guilty of listening to respond. So practice the acronym WAIT. Why am I talking? Just be kind and be thoughtful, and know that this person is working through stuff, and so are all of us. But it'll be okay if they have somebody in their corner just cheering them on.
I think for me, I would say, do your research. Do your research and check out any and all opportunities that are allotted to you through either your local government, your county government, your state government, because there are tons of programs out there that will help you navigate being HIV positive. And I'm a firm believer, if it's offered to you, say yes. don't be ashamed to accept the help. People are put in these positions to do just that because they love to do that. Devin, Jess, SJ, we're all here to help. And if you ask and are not ashamed to it, we will be more than willing to do so. I think far too often we get into this place in life where we feel that we got it. And reality is, no, we don't have it. We can always use some additional help, and it's okay. So ask for the help that you need. Even if you don't think that you need it, ask for help. I'm asking Devin and Maddie constantly for help because I may have it, but the little extra help will push me over the line. So yes, ask for the help that you need.
So first, I want to just shout out Greg and Devin. Just thank you both for sharing your story. I would imagine no matter how many times you may have done it, it's never easy. So just thank you for just being y'all. And I have the privilege to work with both of you. So anyway.
Thank you, Jess.
And I just love that you're both unapologetically y'all. And thank you, SJ, too. I work with SJ as well, and she's also amazing. I want to say to anybody living with HIV, no matter where you're at in life, if you're ready to engage in care, do it. And it doesn't matter where you're at. It doesn't matter if you are actively using drugs. It doesn't matter if you are homeless. It doesn't matter if you are an executive at the bank. If you're ready, do it. Don't hesitate. And then to sort of piggyback a little bit on what Greg said, for people that are not living with HIV, if you have someone living with HIV in your life, do your research, read, understand what are appropriate responses and what aren't, and read beyond HIV, read literature about how to support people that are going through difficult chronic illnesses and how to respond and what to say. Oftentimes we put the onus on people living with HIV to educate us, and that's too much. And we don't always say the right thing or know how to be there. So just do your research. I like that, Greg. I'm stealing it for a brief moment.
And I don't think I could say anything that hasn't been said better already by you three. So thanks so much for your quality insight and input.
Thank you. And thank you all again for participating in this discussion. As you all have said, and I think there's a common theme that has been spoken about, really just having conversations, whether it is with folks to learn about HIV, whether it is to inform someone that you are newly diagnosed and you need support, or if it's just being there for someone who you found out is newly diagnosed, or someone who's living with HIV who needs you, and just having those conversations and being there for folks and educating whenever possible. I always joke around saying that we're not going to be able to end the epidemic until sexual health is part of regular conversations at the dinner table, at the living room, on the way to work, wherever. Like, if you can't talk about sex with people who are closest to you without feeling stigmatized or without feeling some sort of shame, then we're not at the point yet that we can end the epidemic. So you all have really taken a step towards making that possible through the work that you do and the way that you engage with others. I look at this panel and I think, oh, two of you, I have been engaged with care at some capacity. Devin being peer navigator at one point and Jess being my physician. So I know the work that you do personally through that, and I have to give shout outs to that. So thank you all for participating, and thank everyone who is attending. There has been a significant amount of chats that have come through just praising you all and the work that you do, and for Devin and Greg for being so open and being, I think Jess spoke unapologetically, you. So they are saying this is the best session that they have seen thus far in the summit. So with that said, if anyone is seeking continuing education credits for this session, or any session, there is a link in the home screen of the conference platform. So you can click that in the main navigation panel, and there's a link to a survey. Even if you're not seeking continuing education credit, you can still fill out the survey to give us feedback on all the sessions. So if you are doing CEs, you only need to fill out one survey through the entire conference, not one after each session. So thank you again, everyone. Have a great rest of your day. And there is one more session happening in about 15 minutes at 1 o'clock, where we will have our closing plenary. Thank you.
Thank you.